I want to use this segment to tell you a little bit about our practice and how our practice is different to any other practice that you may visit. I came to Ventura County in 2006, and I came from an academic institution. I was a full-time academic. I used to run the Department of Fixed Prosthodontics and Operative Dentistry at the University of Southern California School of Dentistry. So, having been in an academic institution, I was used to a very, very high level as far as treatment delivery is concerned. Now, coming into private practice, it came with different challenges, and my vision was to build a center which had high-level treatment without compromise, and also high-end service where patients were treated so well that they really didn't feel like they were in a dental practice. So the goal was to create an environment so that patients were comfortable coming in and didn't have that typical dental office appearance. Now, people often ask me, what is the best thing about your practice? I would tell you the best thing about my practice is my team. We have a group of really well-trained individuals who really, really care. I cannot tell you how much they do behind the scenes to ensure that you are well taken care of. I am truly blessed to have such a wonderful team working with me at Anacapa Dental Art Institute. So when I was starting out building our practice, our new facility has been here, opposite the collection in Oxnard for around 9 years now, and it gave me the ability to build ground up, and it allowed me to design my practice exactly the way I wanted it. First and foremost, I wanted to design the practice so that it didn't look like a dental practice. So when you walk into the facility, you're going to feel like you're in the Ritz-Carlton or Four Seasons. It's an environment which is warm, is friendly. It doesn't have that typical dental appearance, look or feeling or even smell, because I'm aware that many patients are very nervous visiting the dentist, and some of those nerves are related to the smell of the dental practice. So we wanted to get rid of that altogether. So my staff first and foremost are why I'm here today, and how we've built the environment and the facility to a level which really I'm proud of. Now, the second thing which we have at the practice, which is a differentiator, is we have some amazing technology. Now, when we start talking about technology, I'm not talking about any technology. I'm talking about tried and tested technology. When technology first comes out, I'm not the first one to jump on it. I have to ensure that this technology allows me to take care of my patients better and quicker. For example, we have technology like intraoral scanners. Now, what is an intraoral scanner, you may ask? Essentially, do you remember the goop that goes in your mouth through an impression? I'm sure many of you hate that, right? So we employed intraoral scanners so that we can avoid that. Essentially, one of our assistants will use a camera to scan your mouth, and essentially the information is transferred via data onto a screen, and that information is transferred into a 3D printed model where your crowns, inlays, implants are fabricated. So it really is a wonderful way to do things. The second piece of technology we have in our office is a CT scan. Now, there are not many dental practices that have a CT scan. Now, the purpose of the CT scan is to give us a three-dimensional representation of the exact situation in your mouth. So you can imagine, if we are thinking about placing dental implants, or if we're trying to detect certain pathology, a CT scan is invaluable in our diagnosis. We spend a lot of time on diagnosis, and the reason for that is so that we can provide the correct treatment for you. So that gives us some additional information. The third thing we have is an on-site laboratory. Now, I had been working with outside labs for many years, and I never was truly satisfied. So what we have is we have a situation where we have master technicians where we have trained them to a very high level, and they come on site and they will interact with you And the reason for that is we want to be able to give you something which exceeds your expectations, and the laboratory work goes a long way in doing that. So all in all, are we different? Yes, we are. We are a dental practice, but we do specialize in cosmetic and implant dentistry. I'm a prosthodontist. Most of you probably don't know what that is. Most people know what a gum specialist or a periodontist or a root canal specialist or an oral surgeon are. I'm a prosthodontist, and essentially we're quarterbacks of the dental team. And I'm proud to say that we have various specialists on site. So although we do this high-end specialty treatment like implants and cosmetics and so forth, we do provide regular dental care, we do provide regular hygiene visits. So it's essentially everything under one roof. You won't have to go from place to place to place to be able to get treatment. And the convenience of having everything done in one place, I'm sure, is something that you must appreciate. So those are the things that I feel are great about the practice. We've worked very, very hard. Our mission statement really involves taking care of you as the patient and exceeding your expectations every single time.